taking our twins for their regular cancer scans and the results. Our twins have a diagnosis of bilateral retinoblastoma, which affects the eyes, and if not treated properly, can spread outside of the eyes. First, they had those pesky drops, which they hate, and then they had the ultrasound. Then they will get lots of pictures done. And remember, we had to show up for these appointments at 6:15 a.m., and we live 2 hours away, so we only had a few hours sleep. We've had hers done, and then we were moved into the exam room. Now, this process is not easy because when they do start doing these exams, they use like a magnifying glass to get the light in there, and it's not quick. They're really looking in there. Look at the size of those pupils. And then it's pretty much prep time for when the doctor comes in to do the actual exam, which starts right here. The papers on top of them are diagrams of where the tumors are and were inside Ellen Eve's eyes. Then you can compare the size and the depth.
She has responded beautifully to systemic chemotherapy. Today's evaluation, we could see one scar in the right.
So they will compare that diagram to the tumors that are in Ellen Eve's eyes to see if there's been any changes or growth, with the hope that those tumors are dead and scarring. Then it's off to the next hospital. This is where Ellen Eve received their chemotherapy and other treatments. And Eve was also inpatient here for 6 months for other medical complications. This is not over given our girl's history and relapses, and we already scheduled their next scans. In addition, we have Eve's cochlear implant surgery scheduled for this summer, and we're not sure how successful that will be. And I'm also trying desperately to find a way to relocate so Eve can attend a deaf and hard of hearing school. If you watch this video or engaged, thank you so much. And I'm so happy to report that these scans came back with no evidence of new disease.